Hello everyone, and you're watching Joy in Our Town. I'm your host Lisa Harris, joined with special guest Dr. John Crouch. Hello, it's so good to have you here today.
Hello, thank you Lisa, it's good to be here.
You're representing the Good Samaritan Health Service. Could you tell us how that started and who that serves?
Sure. Good Samaritan Health Services is a part of the healthcare outreach to people who don't have access to healthcare services. So we started, interestingly, back as part of the family medicine department of the old ORU School of Medicine. As you may know, that closed in 1989 and we kind of had to decide, are we going to continue? So we really did. We continued on as a family practice doctor training program, moved the program to a different hospital than the City of Faith, which closed. And then we really began to sort of say, what are we going to do? Well, when we moved to the next hospital, we had to set up a religious nonprofit corporation by which we could run that residency program. And we ended up starting something called In His Image Incorporated, and basically that was to do three things: to continue a family doctor training program to support worldwide medical missions, and to do something about healthcare for the underserved in our own community. So we've done all of those things. The support for the healthcare in our own community was sort of the beginning of the underserved population that in about 98, it led to the formation of Good Samaritan Health Services. We looked in the community, we were doing some things in the community, but we said, what we really need to do is we need to do more out in the community for healthcare services.
So what makes the Good Samaritan unique?
Yeah, it's very unique because we actually do a medical clinic for the underserved at no cost to them, but we do that by two means now, one of which is by mobile medical vans, which brings the healthcare right into the community of need, and by partnering with churches, which brings the whole gamut of church ministry type things available to the patient population.
How is the whole person served?
Well, it's because we are partnering with churches, and we're a Christian organization ourselves, so we really see this as a way of doing real whole person ministry, which says we not only look at the medical, psychological, and social, but also the spiritual aspects of the healthcare. And that's where the churches really partner with us, is to doing that real spiritual part of the ministry with the patients.
You mentioned you help the uninsured. What makes, or is there a typical uninsured?
I don't know if there's a typical one. It's really a lot of times it's people who are in the lower socioeconomic class, of course, socioeconomic group, often those who are unemployed, certainly the homeless as well. But in addition, in sort of modern times, it's been those people who had a job but lost their job and then haven't been able to find one for a while. So they'll end up sometimes being uninsured and really have a hard time getting access to health care. So sometimes people who had really good insurance before, now all of a sudden they have nothing.
Right, unfortunately, that happens to a lot of people.
It does happen to some people.
What are the demographics in Tulsa?
Well, the demographics in Tulsa are that there's really greater need, kind of everybody knows, more North Tulsa, although there's pockets of need all around Tulsa. West Tulsa, even on the east side of town, and even certain areas in south and just a little outside of town. Demographics are such that, and maybe you know this already, that there's a real discrepancy in the longevity of people living in certain zip codes in the Tulsa area versus those who have zip codes where they're employed and have insurance and so forth. In fact, the discrepancy was about 14% way back in about 2003 when a group called the Lewin Group did a real big study here, part of the OU and several other health systems, and it was like 14 years difference in zip codes of how long you're going to live. And now it's down to only 10, but it's still very significant. So there is a discrepancy in the health care in the certain areas of our town.
And what community issues are a direct result of being uninsured?
Well, certainly the community issues are certain disease problems that are kind of worse. You probably know that Oklahoma doesn't do real well in health statistics right now. We're about 46th in the nation in healthcare overall statistics. Healthcare behaviors is another area of a problem. But even that, we're like 9th in the country on diabetes, and we're also, about 3rd in the country on heart disease, and one of the worst ones in infant mortality. Well, all of those things are magnified in the underserved population. In fact, those are the ones that, quite frankly, bring our statistics down into those kind of ranges, because our people who have insurance and have good incomes, they get probably as good a health care as anybody in the country. But statistically, you can see from the state statistics that whole population that we have that's not being addressed is what really brings that population, those statistics down.
And I'm sure it's a nationwide problem in every single state. Why be mobile and not have a permanent clinic?
Sure. The mobility is really something we kind of discovered, and that is, if you put a fixed base clinic in just one area, then you're going to reach the people right in that area. But like many cities around the country, and I've been to other cities where I've looked at this, like other cities around the country, there are pockets of people who don't have access to health care and poverty. And so you look around in the poverty, so you have a clinic one site, you're not going to be able to get those others from the other sites that are around. So mobility, by having mobile medical vans, we can take the health care right into the neighborhood of need. And that's really a big plus. So that's an important part. The mobility enables us to have that flexibility to go around to different sites throughout the whole community and address those needs.
That is wonderful. Being mobile, it has a lot of benefits.
It sure does.
What types of screenings and clinics and services are provided with the mobile service?
It's very interesting. When we first started, Lisa, we really had a lot of acute care problems. People coming to us for colds and respiratory illnesses and urinary tract infections and minor skin infections or whatever. What's happened over the years, though, is that a lot of times what we're seeing is the people with chronic disease problems are not finding the availability of those services. So we're talking about diabetes and hypertension and cardiovascular disease and congestive heart failure and COPD or chronic obstructive pulmonary disease or arthritis, all these chronic disease problems, and they're not finding ways that they can get those things taken care of sort of in the underserved programs that are out there. So we've really seen a lot of that. That's probably the substantial part of our patient population now.
I know you've been talking about a lot of the issues that people come in and a lot of problems, health problems that they're having. Mm-hmm. How do you specifically address those in a mobile truck?
Yes, well, and in fact, the mobile truck goes to these different sites and we have people that help us process the patients to get them into the mobile van. We actually have a nurse and doctor that's there, so it's really good to have the qualified people, and they go ahead and do the history and everything that we really need to do. Find out what the problems are, and then we actually have relationships with both lab people, x-ray people, so that we can provide a pretty full services. We also provide medications for a lot of those patients. So we're really able to provide pretty much what a doctor in his office would be able to provide. And in fact, we do a little more than that, because doctors don't always give you your medicines, and we actually give the medicines to the patients. We probably supply about 60% of the medicines that the patients come in for, and the others we have arrangements for them to get like $4 prescriptions at Walmart, and or we even help them to get direct medicines from the pharmacy companies.
Because a lot of people don't have that transportation that they need to go out and get those medications.
Exactly.
So that is a wonderful benefit of having the mobile truck and all the volunteers.
Exactly.
Good Samaritan Clinic, where in the world do you select these locations?
Well, that's a great question. We tried to figure out exactly where we could be most effective. And so we really ended up doing it in sort of a three-step process. Number one is we got in touch with some of the hospitals and said, where in the town, what zip codes, do you have patients from who really have no money to pay and they don't have good access to health services? So when they show up in your emergency room or they come to the emergency room and they get admitted to the hospital, what are the zip codes for those patients that you really find out where they're from? And once we found out the zip codes, we asked ourselves the second question was, well then, is there any other medical services available? Somebody else is doing that. Neighbor for Neighbor Clinic or OU or OSU or any of the other clinics. And the third question we said is, then are there churches that are willing to partner with us in that particular location? So it's basically zip code, getting the analysis for where the real need is, looking at other healthcare services that may be available. We're not trying to compete with anybody. And the third thing was then, do we have some church partners to really do this full whole person care that we're doing?
How long does that strategy, how long does it take to actually find that perfect location?
It does take a while sometimes, and it really is kind of like sometimes we'll identify a place that we think is really a place of need. Then we got to find out, is there some other healthcare services available? And frankly, are there some churches that are right there that can partner with us and would be willing to do that? Sometimes it's taken us a little while to find the churches that are saying, oh yeah, we're interested in reaching out into the community and we're ready to get some volunteers to do that. One of the things we do sometimes is we've had the mobile medical van go to the church sort of parking lot on a Sunday morning and sort of say, now there's a possibility we can do a healthcare clinic, and the pastor announces it and people come and tour the van and they can sort of see what's going to be available.
That's a wonderful opportunity for the people that may be interested. I mean, the hands-on actual experience there in that truck. Do zip codes change? Do partnerships, churches, things like that, does it change?
Zip codes I don't think change particularly, but you may be saying is the need in certain zip codes change.
Yes.
We haven't seen that a lot, but one of the things we have seen is that sometimes we'll establish a clinic in a particular zip code, and for whatever reason, that church doesn't have the resources or available volunteers to help us with that. So we've sometimes had to shift within a zip code. So if we have one area that we have a clinic and a zip code is going on, and it's not really working out very well for the church or for the folks that are there, we look within that kind of nearby area and say, what other church partnership or whatever place can we do this?
How can someone find a Good Samaritan location near them?
Well, it's very good that we'll have information on the TV running here that will tell you how to get by phone number and or by kind of website to get to that. One of the ways that we've done this is as we've looked at this whole process of how do we find the clinics, we now have clinics pretty much all over the greater Tulsa area. We have some down south near Glenpool and that area. We also have some that are over a little bit towards Bixby. We have them on the west side, we have them on the north side. And so we really have clinics kind of scattered all over. So there should be a clinic relatively near all of our viewers' audience. There's people there. We have a clinic somewhere. So if they'll go to those sites that we'll be listing, they'll see that there's a site that's probably pretty near them.
And we're going to be right back after this special announcement. But don't you go anywhere, because we're going to have more information about how you can connect with a Good Samaritan.